I think there's two or three things. One is there is a lot of excitement about managing CAH patients now. Now, I'm an adult endocrinologist, and I can tell you a lot of adult endocrinologists do not like to manage these patients because it's hard and because you can't come up with the easy regimen that you know is not going to harm them in the long run. And so now I think there's a lot of excitement in the adult community that you can do what we think of as a block and replace strategy. You suppress the androgens with the one drug and you replace the cortisol deficiency with another drug. Anybody can do that. So I think, that will make more adult endocrinologists interested in taking care of these patients. That will allow better transition of care from pediatric to adult care. In fact, we had at the endocrine site, we had a couple of audience polling, and it was at least 50% of the children that the doctors in the audience, the endocrinologists in the audience, felt did not get transitioned to adult care smoothly. At least half of them, which is very unacceptable. All right. And so we need to have good care during an adolescence so that because that puberty time is very critical for them reaching their adult height, and then a smooth transition to adult care, and then a long-term game plan to prevent the burden of disease that these people have that we know from the natural history studies that they suffer from. So I think there's excitement in learning about CAH. There's excitement in taking care of these patients again. And there's an option for the pediatric endocrinologist when they've done everything they could. And, they know that if they use a higher dose of glucocorticoid, not only are they going to get obese, but they're going to suppress their growth. They're going to interfere with their sleep and their pubertal development. They have another option now that is not going to put them at risk for these things. So again, I think it's, it's not every child with this condition that's going to need this drug. There are many kids who are well managed on a pretty physiologic dose of hydrocortisone, but for the ones that we can't get control, and we still don't understand why this is. We don't know why they have different hydrocortisone dose response relationships than the other kids. But now there's a better option. Well, they're going to be following their growth curves. They're going to be following their weight curves. That's like the vital signs of the child, right? I actually kept track of my kids' growth curves and weight curves. And, if they're noticing that, they're falling off their growth curve, their weight curve is going up too much, even though their labs look good, you got to bring that to the attention of the pediatric endocrinologist. The child may be within the range of what we think is safe, but for that child, they may not be growing well. So say, hey, did you think about one of these new treatments? And by the way, this work on crinecerfont has actually propelled other companies to start to develop alternative targets for treating this disease. So again, I think there's a lot of movement in this area, but you're the steward of the child's growth and weight curves. And if something's looking wrong, you got to bring that up to the endocrinologist. They may not be aware of it. I mean, they usually keep their own curves, but they may be accustomed to, the slight reductions and so on. But you should be the advocate for the patient and point out that they really might need something else. If everything's fine. Like I said, not everybody needs this drug, but there's a lot of kids that are going to benefit, especially the adolescents as they go through puberty and their schedules become complicated. So, taking multiple daily doses of hydrocortisone is challenging for a lot of middle school and high school students. So this might, but again, they still need the cortisol replacement. They still have to get that delivered to match the needs of their physiology. But the extra doses, the late day doses, the bedtime doses, maybe they don't need those anymore.